Live from Dallas and Fort Worth, this is a special edition of CS 11 News at 6, Tracking the Tests.
Hi, everyone. I'm Doug Dunbar. Thank you so much for joining us for our special edition of CBS 11 News at 6 o'clock. It's COVID-19, tracking the tests. Health experts have long told us expanded coronavirus testing is going to be a major key to opening the economy safely. But with more tests comes more confusion and questions like, do I meet testing requirements? Where do I go? Do I have to pay? Are antibodies the answer? And how exactly does contact tracing work? There's still so much we do not know about this illness. Infectious disease experts do not have all the answers. While there are no simple solutions, during the next half hour, we're going to take a moment and hope to give you and your family a better understanding of the testing options that are available, how it all relates to managing the pandemic, and your very own health and your safety. We mentioned large population testing as a necessity in an economic recovery, but that also comes with isolating those who are infected, finding people who have been exposed, and then ordering them to quarantine. There are drive-through testing sites for coronavirus all throughout North Texas. Our Jack Fink takes us to some of them as we start with who is being tested.
Please come visit us. That's what we're here for.
As more testing for COVID-19 becomes available, the CDC has widened the criteria for those who can be tested at federally supported drive-through sites, such as the American Airlines Center and the Ellis Davis Fieldhouse in Dallas. Since the change April 27th, the incident commander of the two Dallas sites, Randall Payton, says he has noticed a difference.
We're seeing a lot more participation since we expanded the criteria. And yes, we've seen more positive cases coming through that.
Payton says for 7 of the first 9 days of the expanded criteria, they have reached capacity at each site of 500 tests or 1,000 combined. About 400 of those tests each day are reserved for Parkland Hospital nurses to test nursing home residents and the homeless. The CDC has also expanded the number of symptoms for COVID-19.
You could have a fever, a cough, a shortness of breath. You could be over 65 years of age. You could also be anyone with chronic health issues, underlying issues.
And aside from first responders and healthcare workers who can get the tests, whether they do or don't have symptoms, certain other workers can now as well at the Dallas sites. They include DART bus drivers, grocery store employees, and workers at other essential retailers. Dr. John Carlo, a former director of the Dallas County Health and Human Services, says it's a good idea.
If they're part of, an essential workforce, or they like a healthcare worker, or as a grocery store worker, there are good reasons why you may want to get that test.
This allows the workers to find out if they have the virus, so they can isolate themselves before getting coworkers or customers sick.
There isn't just one set of criteria to get a test for COVID-19. Instead, it depends on who is supplying that test and where you're having it.
At drive-through testing sites operated by Walmart and Walgreens, they follow the CDC's guidelines. Hospitals have their own criteria for testing people for the virus. And now that hospitals are allowed to perform medical procedures again, some are now testing all of those patients for the virus 48 hours beforehand.
There's all these different variables, and ultimately it does take some judgment in terms of when you should test and when you should not. But this is not really unusual. We do this every day in medicine.
And Kroger said today that it will start offering some more free tests for COVID-19 later this week. First, you've got to go to their website and get registered so that they can screen you to make sure that you meet the CDC guidelines. Starting Thursday, you can go at the J.P. Elder Middle School in Fort Worth. And then starting Saturday, you can also go to City Square's parking lot in South Dallas. Days and hours are limited at each site. Doug?
Good information, Jack. Appreciate it. Let me ask you this. While medical experts are certainly saying that more testing for the virus is needed in our state, here in Texas, there are also limitations of those tests as of right now, right?
Yes, and the experts say while these tests for the virus are mostly accurate, they're really just a snapshot in time. They're only good for the day that those tests are taken, so that just because you test negative one day does not mean that you couldn't get the symptoms and ultimately test positive in the days following that test. Doug?
Makes sense. Makes sense. Jack Fink, thank you so much. We appreciate it. Public screening and COVID-19 collection sites are available all around the state. In person, you can get to drive-through locations as well. The Texas Department of State Health Services, in fact, has a detailed map of all the sites and a search tool as well to help you find the closest one to you so you don't have to mess around. Just plug in your address or your zip code. You can drop a pin on the map. We've got a link to this map right on our website. That's at cbsdfw.com. You'll find this under links and numbers. And when looking for a testing site, there are some key things you want to consider. Things like the screening criteria for that particular site, the operating hours, whether you need a doctor's referral or not, how the billing process there works, also the type of test that is being offered, and how to get the results. If you have any questions, it is always best to call ahead. And one of the reasons why testing is important is because it allows health officials to track infected people. That is called contact tracing. You've heard the term. Experts say it may ultimately help prevent the spread of the virus, and the data collected then helps doctors understand how it is spreading in our local communities. A retired Dallas nurse gave us a behind-the-scenes look at how it all works.
We had gotten information that you had a lab test.
This is where retired Dallas County nurse Vicki Yates spends hours working.
That was positive for COVID-19.
Getting detailed information from people who have had the virus.
I've had them go for 45 minutes to an hour, and that's just one person.
She's helping patients retrace their steps. Who did they meet? Where'd they go? And possibly, how did they get the virus?
Go day by day, and sometimes I'll ask them, can you look at your calendar, maybe look at your bank account to see where you might have been.
Vicki then starts calling every single person that patient may have exposed. She says people are often taken off guard, and what makes it hard is that she has to do it without identifying the patient.
We do ask them to kind of isolate themselves for the 14 days.
Currently, there are roughly 180 trained contact tracers in Dallas County, most of them volunteers, including medical students and retired nurses, just like Vicki.
I feel like I'm giving something back to the community.
As an unpaid volunteer for the county, she says she reached out to hundreds of patients and their contacts, all in an effort to stop the spread.
That's what I went into nursing for. And that's what probably most nurses are doing.
Whether they are inside the hospital or sitting at home on the phone.
And I'm calling on behalf of Dallas County.
I'd like to take it back now to the beginning, because when it comes to testing, for most people, it all starts with symptoms. Dr. Julie Trivedi, Medical Director of Infection Prevention at UT Southwestern Medical Center, has agreed to help inform you this evening. So we started our discussion with the list of the new coronavirus symptoms that have come out that have been added now to what was initially a short list until recently.
They added about 6 additional symptoms. So one of those is chills. The other is shaking with chills, as we call rigors, headaches, muscle aches, an abnormal loss of or abnormal sense of smell or loss of smell, and then abnormal taste. So we have the medical terms for those, but those are the 6 new symptoms that were added to the existing symptoms of fever, cough, and shortness of breath.
We're in North Texas. Allergies are a beast for most people. In your opinion, how do we best differentiate? Because we're all freaked out about either of those symptoms, right?
Absolutely. So allergies tend to cause more focal symptoms. So you might have more of a runny nose, an itchy nose, itchy, watery eyes, maybe a little bit of sore throat if you have some postnasal drip. And then you might feel also a little run down or fatigued, but you normally don't typically see a fever. You probably don't have shortness of breath or trouble breathing, and you shouldn't really have the muscle aches that would occur, let's say, with an infectious disease such as a flu or other respiratory virus.
Doc, for those who believe they have symptoms, and let's say they have visited their doctor, I've seen a few stories along the way, especially on social media, where they've gone to their doctor, they say, here are the symptoms that match up, yet the doctor doesn't order the test. Do they have an alternative besides that doctor they've gone to see?
So yes, there certainly are alternatives. I think we need to be able to think about what are the testing options in that geographic area, so what is available to the patient in that area. The other thing is whether or not the test result is going to change what we call the management. So what is it that you're going to recommend to your patient anyway? If you have signs and symptoms that seem concerning for COVID, I think we get some mental peace of mind from knowing the result of a test. But the recommendations are still going to be the same about, isolating yourself at home, not going out to the grocery store, using hand hygiene, protecting, yourself from others.
So we've got good information so far from the doctor, and we're going to continue our discussion in a moment, including her take on the race to develop a vaccine. Also ahead, a closer look at another kind of test that has now emerged as a potential pathway to helping reopen the economy, and the treatment that is saving the lives of critically ill COVID patients. What you need to know regarding plasma and donations. Straight ahead.